Thank you so much all for joining. My name is Lynette Juma from the Local Development Research Institute. A bit about us is the Local Development Research Institute is a think tank, is an action-oriented think tank based in Nairobi, but working across the continent to support efforts by African governments to, end inequality, extreme hunger, and poverty. And we do that sort of through two different practices. So one is a data for development practice, and there essentially is sort of leveraging different types of data, formats of data to help, governments, have better socioeconomic development outcomes. And our evidence, sorry, I just have to sort of admit it one as well, so sorry about that. And our evidence program is very much about linking government actions or, decision making to tangible evidence. That's a bit about ourselves. I'll sort of put a link to our website on the chat, and if you'd like to check us out, that would be great. So the Africa Open Data Network is a program under the Local Development Research Institute, and this program specifically focuses on bringing together different stakeholders across the continent to see how we can sort of publish better data, use data, and sort of leverage existing sources and advocate for more data to be published by government so that, it can be used for better socioeconomic development outcomes. It's called Africa Open Data Network because in the past we have very much focused on the availability of open data, but going forward strategically, we're sort of broadening that to go beyond just open data. And a few of the projects we've implemented in the past sort of have also not just focused on open data. So we host this monthly webinar on the last Thursday of every month. And it's our way of bringing together different stakeholders to talk about issues that are relevant to the space, around data, evidence, and just sort of to see the connections between traditional data focused people and domain experts or different sectors such as health, agriculture, education, and that. So today we are super privileged and excited to have Elizabeth Thuo from Qhala, who'll be talking to us about big data, AI, and the public service. Elizabeth is a data scientist at Qhala. And her work there sort of involves the building of platforms and ventures that solve key societal and economic problems. So, from this point on, I will give it to her. So maybe Elizabeth, you can start by just telling us a bit about yourself and maybe a bit about Qhala so we can, get to know exactly what you do.
So my name is Elizabeth Thuo. I am a graduate from Jomo Kenyatta University of Agriculture and Technology, where I studied actuarial science. And I'm also a graduate holding a master's in statistics with data analytics from Brunel University in London. Interestingly, I just found myself in Qhala a few months ago, which was quite great after some experience in customer experience. And also I've worked in finance in a company called Atlas Copco. So I'll be leading the webinar today, and I'm encouraging you to post your questions on the chat in case you have any, and I'll start. Qhala itself is, it's an organization that creates product services and builds business models. And we tie together strategy, research, design, and technology to solve today's needs and future goals. So we listen to our clients and we innovate to improve their processes. So we've done a bit of work with energy customers, retail, gig economy, and we're also working with businesses in these industries to identify, plan, and capitalize on digital opportunities. So I'll start the presentation now. Oh, hang on. So today's topic is going to be about big data, AI, the public service, and maybe the COVID-19 response with the assistance of big data and AI. So what does that look like? So government is potentially the major client and public champion for new data technologies. So the data science tsunami, led by multinational companies like Amazon, Google, Uber, Alibaba, is radically changing how we work and socialize and is disrupting employment. The disruption is being caused by key technologies, the artificial intelligence, Internet of Things, big data, behavioral and predictive analytics, blockchain technology, and it offers a great potential in public sector to transform the way governments engage with citizens, make policy decisions, and manage national infrastructure. So sophisticated data and analytic infrastructure, when combined with trusted record keeping concepts such as blockchain, distributed ledger, and smart contract technologies, may provide a feasible framework to redefine public services in a decentralized and lower, more personalized manner. So in Kenya specifically, we have eCitizen, and it's a start in introducing the data science technologies into the public sector. So ideally, each citizen should have a digital identity, a digital signature, a personal record, and virtually all government services should be digital and online in a perfect, big data and AI democratized government. So from this map, we can see, the distribution of AI-enabled already countries, and the very blue ones would be the ones that are AI ready. And I found it off of the International Development Research Center. So Kenya, when looking at Kenya, you can see that data science has, pioneered in the private sector, and it's ripe for transforming the public sector, sorry. Just give me a minute. The Government AI Readiness Index 2019 classifies Kenya as number 12 in the African countries. So it's in the top 100 countries, but it's number 12 in the African countries. The other countries that are closely following Kenya are Tunisia, Mauritius, South Africa, and Ghana. So the AI has power to transform the way governments around the world deliver public services, and this will improve citizens' experiences of government. So this index is actually a qualitative toolkit designed to provide an overview of any government readiness, and it's really good. But the program started in 2017, so this is just the first indexing they've done. So hopefully we're aiming to be, tech ready. And, Google recently in, 2018, 2019, opened an AI lab in Accra, Ghana, and University of Lagos has also launched an AI hub in 2018. So Cape Town, Addis, Kigali, and Nairobi are like tech cities. They're the Silicon Savannah. So here it's just a summary of what said, where Kenyan's ranking is in the world. And the potential government tech systems could actually be revolutionized using chatbots, robo-advisors. You could also have use cases in management of infrastructure using Internet of Things and blockchain. You could also use automated compliance, regulation using robo-advisors as well. So just robotic advisors. Public records and secure storage could be done using blockchain distributed ledgers. The judicial and dispute resolution systems could be greatly improved, and they have during this COVID period. We've seen some changes. We've seen delivery of judgments online on Zoom and a lot of platforms. And then the laws and statutes encoded in our constitution could also be stored as a blockchain smart contract. So it's good to see all these inventions with the advent of AI and big data. So the algorithmic government, what would that look like? So in public service, that just encourages interaction and delivery of service to citizens. And that interaction could be using the chatbots that I've mentioned in the previous slide, and ease of election processes, online delivery of services anywhere you go. Supporting civil servants could also be using, like a robot, an online robot or a chatbot. National public records, how can we do that? Form submission should be easier with, big data, correspondence, emails, blogs, personal and citizen data, back office operations, that should be very easy. National and physical infrastructure, we can create smart cities. I don't know, there was conversation about Konza a few years back. Transport and communication and environment monitoring, that can be easily enhanced with big data as well. And, maintaining laws and statutes and managing courts and judiciary and police, laws and, codifying and verifying, laws in government, prosecution of, tried persons or persons in error, online dispute resolutions and arbitration. That could also be a key player. On.
Elizabeth?
Sorry,
okay. There you are.
So in transforming government, new important data technologies include, government data facilities. We can see that here on the slide. So the public data portals collected by national and local governments, that they are open to public access and analysis. That would make it very good. If we could have maybe a www.data.ke, the Internet of Things and interworking of smart physical devices or vehicles or smart buildings, like I think the Standard Chartered building in Nairobi is a smart building. It's one of the good examples. This enables the objects to collect and exchange data. Artificial intelligence systems are able to perform tasks normally that would, you'd require human intelligence, but an AI system can do that. And then the big data processes, they examine very large data sets to uncover hidden patterns and known correlations in data sets that are so complex that traditional data processing application software is inadequate to deal with them. The behavioral and predictive analytics, that analysis of large and varied data sets to uncover hidden patterns and known correlations, customer preferences, that would be useful in making informed decisions. And then blockchain technologies would be useful in underpinning digital currency that secures and validates processes and transactional data. So this is a picture I took off of Getty Images. It just shows a quote that artificial intelligence could be used one day to tailor education, the educational needs of each individual child. So this is already happening with COVID-19. Institutions of learning have to really think about how to revolutionize learning and make it accessible anywhere you are. So this is a really big area that AI could play into, especially for the Ministry of Education to, make education reachable for every demographic. So when you're rethinking a government with AI, what does that mean? It means that policymakers should harness data to deliver public services that are responsive, efficient, and fair. So policymaking processes were designed very differently in the, in the earlier days, in earlier times. And governments rely on custom-built data through usually national statistics offices, like, the Kenyan Bureau of Statistics, or just conducting surveys or sensors. They have no tradition of using transactional data about people's actual behavior to improve policies or services. So in today's government interaction with citizens, they generate trails of digital data almost every minute. So some of the examples I found to illustrate how AI is revolutionizing the African scene is we have a Sophie bot that's been created to just ask the difficult questions, like, is it easy for parents to talk about sexual and reproductive health in Kenya? So someone saw there was an opportunity there and created a chatbot called Sophie bot. Then the Zenvas Advantage is a smart farming product in Nigeria that is really smart. It enables data-driven farming and farmers can produce more. They can also be ahead of disease outbreaks and are able to identify if pests are going to attack their crop, or just makes farming into a business. So they offer both products and services, and there's electronic sensors or yields, so a camera that can model vegetative index of crop farms, and they also have APIs that can fetch data about crop growth and soil fertility profiles with their product. Then there's another run product called Babyl's chatbot that also enhances digital healthcare platforms. Then there's a drone for good. It's been made by the Atlan Space Morocco, and it guides autonomous drones so that they can prevent environmental crimes such as deforestation, fishing, illegal fishing, or poaching of animals in South Africa. So usually the drone detects like a boat and classifies it using it, so it becomes a classification problem, either into a cruising boat, a tanker, or a fishing vessel. It establishes then if the people operating it are within the marine protected areas, or if it's an authorized fishing vessel. Then if the activity is illegal, it sends a register to a boat location, to the authorities, the people who can, the marshals, they're coast guards, yes? I think they're coast guards. So it sends the ID number, the number of people on board, the information relayed and the information is relayed via satellite to those authorities. And then the government employs light aircraft instead of using drone technology. Usually the government employs light aircraft or deploys Coast Guard for surveillance. So this saves costs a lot because you're just able to send a drone to maybe an area of 800 kilometers. Then Apollo Agriculture uses M-Pesa mobile money and machine learning and satellite data to guide credit and product it offers. So there's an AI-enabled labor market in Kenya, and how that works. We have a Finnish company that applied an AI-enabled labor market assessment tool, and they use it to analyze online job advertisements from select online job portals in Kenya. And they use the computer science curricula from the University of Nairobi or Moi University to identify the gaps between what the labor market is looking for and what the university's curriculum is providing. So they just bridge that gap between academia and industry. And then there's a South African fashion retailer that uses an algorithm to predict the next season of top sellers. So, like looking at what would sell today, what sold really well last season, and then just trying to modify that a little bit because the customers liked it, and just marketing that and throwing it back to the market. And then there's a Nigerian mobile lending platform that uses ML to evaluate credit evaluation. So they're just a few examples of African space so far. So I can debate over about the COVID cases being announced every day. Next slide. So I'll just go ahead. This is case detection. Yes, let me talk about this first. So the social media index search can be used to detect either suspected or confirmed cases. So you can pick from the press release the keywords that appear on social media sites and use those to assess whether the clinical symptoms that are being reported, the text analytics can conclude someone as being either symptomatic and showing COVID symptoms. And then mobility data has also been identified as a key method of assessing infection spread. We can give an example of, Uber Analytics or Google Analytics. So that has been really key to show, how people move and how the disease moves, because that has informed restrictions, especially with the COVID-19 work that we've been doing. So that has been really key to, to point out movement and how the disease moves, and to either encourage policymakers to ease or tighten restrictions. Going back to contact tracing with big data. So in smarter cities, you could have smart cards that pay either the buses or the metro, or here in Kenya we have Msafiri. So we could leverage that to understand how we can do proper contact tracing, because it hasn't been fully explored. So that would identify some features of importance from the location metadata and tags on social media as well, to validate that a person was at a certain location at a certain time, and can provide a tracking model that could trace people even if they do not have the tracking equipment or mobile phones with them. So just two phones communicating, sharing their Bluetooth data, that ascertains a person was at a particular location at that time. So of course the data has to be heterogeneous, and the architecture to ensure that the margin within the big data environment has to enhance real-time and monitoring of the public health surveillance systems. So a few of the big data analytical platforms are listed here. They're super technical, but we can cover maybe two of them. So Apache Spark, it uses a machine learning algorithm for clustering and classification, where data is mapped and reduced and filtered by passing information to the Spark runtime framework. So it's really, really, really interesting how you can actually, pipeline your data and have it run on, if you want to visualize it, you can do that. Or if you want to run a machine learning algorithm, you can also do that and carry out a regression or classification problem. So that's quite interesting. And then there are others that do the same thing almost, and also others not mentioned in this webinar. So for the AI-driven solutions addressing the COVID-19 pandemic, you'd want to understand what is AI. And AI usually is divided into two. We have machine learning and we have deep learning. Machine learning is the ability to learn and extract meaningful patterns from data. And deep learning would be a class of ML algorithms that exploits several layers of representation to find a complex and inherent relationship in data. So it learns by representation and allows a machine to receive raw data and to automatically find the vector representations needed for the detection and classification of attacks. So some of the case examples for contact tracing with COVID-19 would be using AI to track and identify the spread of COVID-19. So we can use smartphone technologies that use AI and have been deployed to trace a person's location and scan a public space for potential infected persons. Could be either through infrared cameras or computer vision surveillance or facial recognition systems. And we have an example for what South Korea have done. They've installed GPS phone tracking, and they also have implemented credit card history and surveillance video recording. And also they do call the citizens to find out if then you have COVID, what is the step? And I think that is being done in Kenya as well. If you have been in contact, especially in the early days, if you've been in contact with someone who is COVID positive, they do call you to find out who it is that you've been in contact with, and they're using that information to prevent COVID spread and encourage isolation. And also the isolation facilities that were recently closed, that's exactly how they found the people. And in Singapore, they have an app called Trace Together. So it's a mobile application that enables community-driven contact tracing, where devices exchange proximity information and duration through Bluetooth. Case detection with AI could happen using AI-powered temperature screening that can be deployed in a public location in a COVID-19 pandemic region. So it can be in a small location or a big location. So major cities and smaller communities. Thermal cameras provide thermal imaging for body temperature for COVID-19 case detection to quickly identify individuals with an elevated body temperature. This, I think, has been implemented mostly in airports, and AI-powered smartphone apps to track geographical spread of COVID. Most of these apps have been aimed at predicting which populations and communities are the most susceptible to enable real-time dissemination from medical health providers and to notify individuals of potential infection hotspots in real time. So we have also chatbots that can, of course, chat someone who is potentially, displaying symptoms of COVID, and they are used as visual assistants to provide information on the virus. And then, of course, diagnosis robots to diagnose diseases. And then I think it's Apple and Google. It's a combination of those two. And then summary of algorithms within AI. We have a convolutional neural network, a recurrent neural network, and a LSTM network, long-term, short-term memory. So that performs diagnosis classification from the initial measurement of the patient. Say if it's a baby and he or she is in intensive care unit, you can predict how their disease trajectory will be. So you'd be able to tell their medical outcome and also explore treatment options. So there's a new field called, nature-inspired computing methods. These are optimization techniques based on behavior of living organisms. They combine different domains of computer science with other sciences, physics, chemistry, math, biology, engineering, and allow for development of new computational tools such as algorithms and hardware. So a key algorithm has been an algorithm called Will Optimization Algorithm, and it uses feature selection and is currently proposed for diagnosing and predicting COVID-19 cases in the US. So I think I've covered this as well. So traditionally they were used for car tracking. So this can actually be used, it can actually be used again for contact tracing during the pandemic, but attempts have actually not successfully been made to implement the same model. And then we have here shortcomings of big data analytics when it comes to COVID-19. So it's actually hard to determine the accuracy and reliability of social media posts because there's a lot of misinformation out there. And then the architecture for sharing and merging remains widespread in that it's really hard to do case detection and tracing of contacts, especially in the African context because of either lack of reagents and just, contact tracing is harder because our demographic doesn't allow us to remain at home or people are stigmatized. Hello, can you hear me? Stigmatized, and they wouldn't want to maybe inform others of their COVID, whether they're or not they're COVID positive. Shortcomings of AI-based technologies are, there's accuracy and classification of features by backward propagation methods that suffer from overfitting and underfitting. And then once the network learns any set of weights, the new learning causes catastrophic forgetfulness. So you have to really iterate or teach the model again. So yeah, you'd have to find a sweet spot for that to be more accurate. And backpropagation can be optimized locally, but it fails globally, which affects the accuracy of classification. And then capabilities of, the nature intensive inspired computing models, that it uses randomized parameters to find the most or near optimal solution that maximizes the classification accuracy. It also applies randomization to learn new parameters, and so that you can optimize learning. So that removes a lot of bias, either human or otherwise, that could be within the algorithm. And then the ability to exploit local search and find the most optimal global result is also a really key thing. And that makes it more powerful, more than big data or AI-based technology. So within my work as well with SHICO, there is the University of Nairobi, the Center for Epidemiological Modeling and Analysis. So this center brings together a multidisciplinary consortium of epidemiologists, infectious disease specialists, clinicians, mathematicians, statisticians, computer scientists, engineers, and data scientists, using data-driven approaches to control infectious diseases and improve healthcare in Kenya and the African continent. So far, our work has been it started with modeling COVID, just looking at the number of COVID cases we're having and just seeing what are the key risk factors that make the disease experience for confirmed COVID cases worse. And so we have mapped out within the site, this site, www.sema.africa, we have mapped out the key risk indicators that make that disease experience worse. But we also looked at the district health information system, where a lot of the data we have in Kenya is housed actually from every health facility. And we've tried to see how those trends changed over time, and especially because of COVID-19. So here I'm just showing you how the gender-based violence reported cases of the survivors of rape have increased during this year 2020. So you can see there was a dip right around March, April, compared to the other years, 2018, 2019. And then there was a steady rise. So it just was in the news the other day about, gender-based violence. And so you can see it's actually quantified by, the facilities that are reporting increasing cases. So that's part of the work that we've done. The other thing that we have within SEMA is Jifahamishe, which is like an information tool to just make you aware of what would be the COVID symptoms. And this was done really early on by Qhala engineers in the pandemic. So it represents a set of digital tools that enables the collection, collation, and analysis of data. The goal is to enable practitioners to collect data and aggregate that data and make sure that it's being used, and also there's a feedback. So it could develop into a bot to actually explain to someone when they're also reporting, location. So it could be a contact tracing tool that the government could find useful, and also to individual users to just inform them, especially at the beginning, what are the prominent symptoms of COVID-19 and what to do in case you have it. The other tool that we've developed in Qhala together with the Center for Epidemiological Modeling and Analysis is an API where you can provide a number of related data sets. So anyone who is interested in getting any data to do with COVID-19 can actually fetch it and use it for their own analysis in the organization, and of course credit the self-check API within SEMA. So it's secure and it's public facing and can be used for, to capture self-evaluation data during COVID. And the documentation is provided there. And the references that I used to prepare the webinar are as follows. And I'd like to thank you for listening to me. I'm ready for questions and open discussion.
Thank you so much. Thank you so much, Elizabeth, for that amazing and very detailed presentation. That was quite eye-opening, but also very detailed, just in terms of what's going on across the continent, in terms of big data and AI, and examples of use cases within the country that help us actually see big data and AI in action. So I'm going to open it up for questions or comments or thoughts. At this point, I have one or two myself, but I'll open it up to see if there's anyone who has any comments or questions. Then I can go next. If you want to ask a question, possibly just like unmute and go ahead and ask. But as we wait, just to see if anyone has a question, I'll go first. So just thinking through what you have talked about in terms of AI and big data, I'm just wondering what you see as potential entry points to build public sector capacity to adopt big data and AI. Within, especially for use for decision making. What do you see as potential entry points for that, especially to build their capacity? Because I think the assumption or the understanding is that it's very, very technical, and therefore, would need extra capacity within government or within the public sector to be able to adopt and use these technologies. What do you see as potential entry points, for capacity building or to build government's capacity to adopt and use AI and big data?
I'll try and answer the question. So in my thinking, the government data landscape is defined by a range of sources, including, the Kenya National Bureau of Statistics that houses a lot of records, and then secondary data that they obtain through administrative operations from front-end services. So in any government office, you'd actually go there and interact with someone. So they'd have some sort of data about what it is that what service you've come to seek from them. And then this user-generated data that can be in the form of a web content. So whatever e-citizen data they generate, or the government page tweets, the president pages as well, either sensory data gathered by people, us, people are the government, and then tracking data like CCTV, because there's CCTV everywhere, at least in the area I live, but I think they have installed in most places to ensure more security, traffic data, satellite and aerial imagery, and then transactional data from all the platforms where you have to make any sort of payment. That would be a good entry point to just check whether the data is just partial, whether it be it economic, demographic, or statistical, or whether it's historical or real time, or depending on whichever text it comes in, it could be a very good entry point. There's a lot of data in government. We just need to find the right ways, and one of the ways would be to partner with government technology startups, because that's public private collaboration, and also hire the right skill. So just develop a lot of or encourage people to go into studies to just master what application areas could be in big data and AI, and also encourage startups. And I think the government does that every year by allocating a set amount of funds, either dedicated to women or dedicated to youth. So if those startups are generating a lot of interest and activity and building, like these apps I talked about, that would be a good entry point. And then the government can now assimilate and try to make and streamline all processes within it. That would be my thinking.
Great, thank you. Again, this is open for discussion. So, anyone else, please feel free to add your thoughts or comments to, whatever I'm raising or whatever Elizabeth is saying as well. I was, just thinking about something else, Elizabeth, in terms of, in the context of the COVID-19 pandemic and the place of big data and AI in that whole conversation. There has been a bit of pushback, regarding investment or heavy investment on AI and big data, especially in the middle of a pandemic, and how that sort of takes away from investment in health systems, which could potentially have more impact in mitigating the pandemic. So I'm just wondering, how sort of do we go around these conversations in a way that would possibly demonstrate complementarity and not competition, and that also, that the investment kind of goes into the health systems, which are probably at the front line of fighting the pandemic. How do we sort of, find that balance between AI and big data is going to solve everything, and not vis-a-vis, people saying, okay, so, but we need investments in health systems and not necessarily in AI and big data, especially in the middle of a pandemic?
My thinking is it actually lies within, the district's health information system. It's already an existing system. And what we've done with SEMA, just visualizing what that looks like to someone who wouldn't really be paying attention to the numbers. So we've just created a very interactive dashboard so that they can see what the situation is in their maybe in their county. And just thinking that Kenya didn't have the advantage of getting Ebola, God forbid. So we didn't have any other pandemic to learn from. So I think there's a lot of data that's being generated during this period, and the government is actually using that data. If you look at the press releases that were being done earlier at the start of the pandemic, and you look at the way the format is right now, it has really changed. There's analytics being put out there. There's, case numbers being put, a visualization to just show case numbers, the distribution of male and female infections, ethnicity, because we have, of course, cases still being imported. So that is quite interesting. And also, to map out, hospital resources and, how many beds and staff we have. Yeah, it's a very good question, but that the DHIS combined with the visualizations that we've tried to do would enable any policymaker or any governor or someone in government who can actually influence change to see what is most needed in their area, I think. And then we've also prepared a data pipeline. So the pipeline now enables you to download data from, SEMA, and you can visualize that data any which way you want, whether you're using whatever machine it is that you want, whether you want to run an algorithm, whether you want to create your own visualization, you can do that. You can access the data. It's more accessible now. I don't know if I'm answering your question, and you can just redirect me if I haven't.
No, thanks for that. I don't know if there's anyone else. We still have about 10 minutes. Just wondering if anyone else has comments or questions. I have one last question, but I just want to open it up to anyone else who has comments, questions, or thoughts, just so we don't lock you out. Anyone? I mean, feel free to also just type out in the chat if that works better for you, and we'll be happy to. Elizabeth would be happy to respond. I think, Elizabeth, my final question is around ethics, and digital rights, so to speak, in the use of big data and AI, especially in Kenya. Of course, there's concerns around, discrimination and mass surveillance, and sort of whether this algorithms kind of carry biases of either the designers or the data that they sort of use. And how do you mitigate that? So if you talk about stuff like online identity and how that already serves to exclude populations or individuals that are already excluded offline, and I'm just wondering whether that's something you have explored in terms of how do we ensure that those are things that we're thinking about, even as we sort of go into this space where there's a lot of AI and big data driven initiatives being implemented in the private sector, but now also going into the public sector. Are these things that we're sort of keeping in mind, and how do we ensure we're sort of preserving rights, in the process of
sijui ni nini inajengwa hapa? That's what I'm saying.
Yes, there is I'm sorry, I ask participants to mute.
Yeah, could you please mute your microphones kindly? All right.
I'll go ahead to answer. So there is a lot of, privacy concerns, ethical and digital rights issues when you come to big data and, you know, AI technologies. But then I believe a lot of that is dealt with at the start. You know, when you're talking about privacy, you want to first seek permission from the user. So is it okay to proceed and, you know, do something, you know, maybe use a user data, because that data still belongs to someone. It doesn't belong to the government or to any private institution. So consent is usually important. And then to deal with, you know, ethics as well, or just to eliminate bias, there could be just, you know, a synopsis where you're looking at, you know, training and iterating, and also including everyone, I think, in algorithms. I think that would be my take, just to include if technology is going to be implemented in Kenya, for example, let it be tested with, you know, maybe if it's a chatbot, maybe it's not responsive, maybe the Apple Siri or something, you could say dialect and intonation, mine is different from yours, it's different from someone else in, you know, Kapenguria, another one in Bomet, another one in Qhala. So it's important that you know, model or application that's being built to be tested on various communities or application areas before it can be passed on. So iterative design and, of course, implementation to remove bias would be a key consideration. When it comes to government, I think it's just that inclusivity. So just including all places in the demographics. So the key debates has been, you know, maybe a more direct use case would be, you know, a division of funds. You know, there's been that talk in Parliament, how to best divide for county government money for use, budgetary allocation. So that could have been really easily done with an algorithm. So just looking at a population and, you know, key areas that need to be addressed in various communities, and just sending it to, you know, like a machine learning algorithm, deep learning, and having it come up with, you know, what would be the best allocation for each region. That I think that's my take. Interesting question.
Thank you. Any additional thoughts, comments? Let's see. There's okay, so there's Peter Muriuki has shared an example of an AI-powered wildlife conservation project happening in Opejeta. So be sure to check that out in the chat. Thank you for sharing, Peter. So, I mean, that's it from me, unless there's any question from anyone. I think, thank you so much, Elizabeth, for taking time to kind of walk us through, you know, your presentation and this very, very interesting ideas. And I think this is a good starting point, you know, for us to continue those thoughts around the use of AI and big data in the public sector in Kenya. So, you know, thank you for that. We have about 5 minutes left, and I know there are people who sort of came in late after we finished. So, I'm just going to stop the recording.